an important part, cardiac cycle and cardiac output. Okay, again, a lot of understanding is needed, its concepts. So before we go there, let me remind you, on Monday, we talked about the conduction system of the heart. Okay, SA node, AV bundle, bundle branches, and the Purkinje fibers. This is the sequence of the conduction system. The SA node is considered to be the normal pacemaker of the heart simply because it produces action potentials at the fastest rate. So these are specialized cardiac muscle cells that can initiate their own action potential. Depolarization and repolarization is possible spontaneously, okay? Spontaneously. And the rest of the structures, the SA node is fastest, 90 to 120, AV node is less, bundle branches and Purkinje fibers are even less. And as I told you, a person can survive even with the AV node as a pacemaker or the bundle branches and Purkinje fibers as a pacemaker. The only thing, the resting heart rate will slow down, okay? With the SA node, the resting heart rate is higher, whereas with these, it will be slower. But nowadays, we have pacemakers. The moment something goes wrong, you can put in an artificial pacemaker, okay? So cardiac muscle, the conducting system, the property is capable of generating spontaneous action potentials without the need for an external nerve stimulation. They don't need nerve stimulation, okay? So what do nerves do? You know that the heart is supplied by both sympathetic nerves and parasympathetic nerves. So the autonomic nervous system supplies your internal organs, and the sympathetic and parasympathetic nerves also supply the heart, okay? So if the heart is able to produce its own action potentials, what are these nerves doing, okay? These nerves, they affect the rate at which action potentials are produced. Sympathetic and parasympathetic affect the rate at which action potentials are produced. They are not necessary to initiate the action potential, but they can adjust the rate. And you know this, sympathetic nerves will increase the heart rate, so they'll make the SA node fire faster. Parasympathetic nerves will decrease the heart rate. They will slow down the formation of action potentials. So that is what they do. They affect the rate at which action potentials are produced, okay? So external nerves are only going to affect the rate. So based on this, when you look at the resting heart rate, so your SA node is capable of firing impulses or producing action potentials at a rate of 90 to 120. But your resting heart rate is generally around what? If you look at your resting, when you're not exercising, what is your resting heart rate like? Usually around? 85. 60 to 70. Anything else? How can you find out your heart rate? What is the easiest way to do that? Pulse, yes. So you can just measure your pulse, radial pulse, okay? So you know that resting heart rate varies between individuals, okay? So it varies with age, it varies with the size of the individual, it varies with the physical fitness of the individual. So not all of us are going to have the same resting heart rate. So the resting heart rate generally falls anywhere between 60 to 90 beats per minute. Okay, that's the beats per minute. So 60 to 90 beats per minute is the average normal. So not all of us are going to have the same thing. Now, this is your resting heart rate. Obviously, during exercise, it's going to go up. The moment you stand up and start walking, it will go up. If you're doing some mental activity, if you're trying to solve something, your heart rate will go up. So, sympathetic, anything. Okay. Why is the resting heart rate between 60 and 90, although your SA node is capable of producing a higher impulse rate, okay, but yet your resting heart rate is always between 60 and 90. This is because during rest, which of these systems is active? Parasympathetic. So the parasympathetic nerves are the ones that influence your resting heart rate. Because during rest, you know, this parasympathetic nervous system is called rest and digest. That's the general way in which it is described. Sympathetic is called fight or flight system. So you know that. So because of the parasympathetic effect on the SA node, that's why your resting heart rate is low. Okay? It's not as high as 100 or 120. What is the most important parasympathetic nerve? The vagus nerve, okay? So always remember that, the vagus nerve, okay? The vagus nerve or the 10th cranial nerve. This is the 10th cranial nerve. So the vagus supplies almost all internal organs, okay? So the vagal influence, what we call as vagal tone, is responsible for your resting heart rate being around 60 to 90, okay? Now, when does your heart rate increase? So what are the factors that can increase heart rate or decrease heart rate? So the term that we use whenever heart rate goes up, we call it tachycardia. Tachy means fast, okay? And whenever the heartbeat is less than 60 beats per minute, it is called bradycardia. Brady means slow. Tachy means fast, okay? So cardia because it's the heart rate. Now, let's look at the factors that affect heart rate. So obviously nerves affect your heart rate, okay? So sympathetic and parasympathetic nerves will affect your heart rate. Your normal breathing cycle can also affect heart rate. Body temperature will also affect heart rate, okay? So whenever you have a fever, body temperature goes up, your heart rate can increase. Hypothermia, when body temperature drops, heart rate also drops. Okay, this is because you know action potential is because of the movement of ions, sodium and potassium. Depolarization is due to influx of sodium, repolarization is due to outflux of potassium. So whenever temperature changes, ionic movement will become faster or slower. So that's the basis, okay? So during a fever, you will have an increased heart rate, okay? Yes.
Would thyroid hormone...
Temperature. So when temperature drops, when body temperature drops, especially you see a lot in severe winters when there are homeless individuals, you will see many of them, if they don't have a shelter, you might see that they lose their life because hypothermia can drop the heart rate to very low levels so that none of the tissues can get oxygen. And we actually use this in the clinical purposes also. if you want to do surgery on the heart and you don't want the heart to be beating at that time, you can pack ice around the heart, lower the temperature, so the heart will stop beating. And then you can do whatever surgery you need, and then you can then rewarm the heart and it will start beating again. So hypothermia, which is lowering the temperature, hypothermia can be used during cardiac surgery. So for certain surgical procedures, they do use hypothermia. Okay, so you can just pack ice around the heart and it lowers the temperature, and once you warm the heart back up, it will start beating. Okay. Then comes your normal breathing itself. So we breathe in and breathe out. So there is a slight rise in heart rate when you breathe in deeply, and when you breathe out, there is a slight drop. Now these are just a few beats. Okay, so when you actually are recording an ECG, and if you ask the person to take a deep breath, you will see that the heart rate goes up a little bit. And if they blow out air, the heart rate will slow down a little bit, but few beats. It's not significant. But this is something you need to know. Remember that your normal breathing cycle can also increase or decrease heart rate. Okay. Then comes your hormones, like Meredith said. So all the hormones that are going to increase metabolic rate will also increase heart rate. Okay, so thyroid hormones, epinephrine, norepinephrine from the adrenal medulla will increase heart rate. Whereas acetylcholine, which is a neurotransmitter secreted by parasympathetic nerves, will reduce heart rate. Drugs, there are a number of different drugs that can increase or decrease heart rate, and these are used especially in people who have failure, cardiac failure, the heart is not beating properly. A lot of different drugs are available. So when you do when you take a pharmacology class, you will learn about all this. Digitalis, Wabane, quinidine, dopamine, all of these are different forms of drugs. So if you want to stimulate the heart and make it beat, you can give dopamine or quinidine through the IV. Okay, so lots of drugs are available. Then comes emotional states, very important. Okay, so anytime a person is in pain or, is anxious, heart rate is going to go up. Okay, and then we will see how heart rate is tied to blood pressure. So heart rate will be high, blood pressure will be high. So if you see a patient in the ER who is anxious and is in pain, their blood pressure is going to be high, their heart rate is going to be high. So you cannot label them as a patient who has high blood pressure. It is the fear, the pain, the anxiety that is causing an increase in heart rate through the sympathetic nervous system. Okay. Now, you also have situations where sudden, unexpected grief, which is totally some shocking news, can cause a person to drop dead. Okay, so this can also happen. Sudden, unexpected grief can totally stop the heart. So it is considered to be like a severe vagal influence, the vagus nerve. Okay, and a person can drop dead. So you might have heard of cases where, someone hears about their loved ones passing away and then they just drop dead. So the heart can stop when there is excessive sudden grief. Okay, you're going to encounter in patients, but of course, if you are of a personality, if you look at people who are type A personality, who are always, highly driven, anxious, they short-tempered, they get angry very fast, they have a tendency to have a higher heart rate. And in the long run, this can lead to higher blood pressure as well. So that's why you're asked to, people who are in that category, extremely anxious, extremely, short-tempered, they always tell them, you have to go in for exercises like anger management, meditation, yoga, tai chi. All of these exercises, meditation, breathing exercises, tai chi have all been shown to reduce your sympathetic drive and increase your parasympathetic activity. Okay, so they calm everything down. They calm all your different systems down. So it is beneficial. So there are scientific studies to show this. It's not that people are just saying it just like that. There are scientific studies which show that, meditation and all forms of exercise do help in reducing blood pressure, heart rate, respiratory rate, even helps with high blood pressure, brings down blood pressure, helps patients with asthma. Okay, so all of these are not just things that are just said. Don't think it is like an old wives' tale. There are a lot of, there's evidence to show that it does help. Okay. We talked about ECG, so I'm not going to go into this too much, but remember at this stage, I want you to know what a normal ECG is going to look like, okay? And so P wave, QRS, and T wave, okay? So that's what you're going to see. With an ECG, you can find out a lot of different things. Okay, heart rate, you can calculate the heart rate, you can see whether the heart is beating in the normal fashion. Is there a conduction block anywhere? Because it has to go from SA node to AV node to the bundle branches and Purkinje. So if there is a conduction abnormality, is there a change in the size of the heart chambers? You can also look at that. And changes in any blood levels of calcium or potassium or even other ionic disturbances you can make out. Okay, and of course a heart attack is something that you can make out. It's not always that ECG is going to show you that a heart attack has occurred or is happening. Sometimes ECG can be erroneous. It may not show a proper heart attack, but you have to look at the ECG plus the symptoms that the patient is coming to you with and then decide on what is happening. There are lots of blood tests that can be done to look for a heart attack. Like I told you, when the heart muscle gets damaged, a lot of enzymes are released, troponin T and all of those. So you can measure that as well. But ECG is the first line of investigation. So the moment somebody goes to the ER with chest pain, especially if they are 40 plus, chest pain, sweating, then they will do an ECG first, okay? And then of course if indicated, they'll do blood tests as well, okay? So this is just a normal recording that you see. The first one is normal, showing you the P, QRS, and the T wave. And then you can find out the heart rate, tachycardia, if the heart is beating too fast or if it is beating too slowly, bradycardia. You can actually calculate the heart rate. And you can find out conduction block. So I told you from the start of the P wave to the start of the QRS complex is called the PR interval or PQ interval. This is a time taken for the impulse to travel from the SA node through the AV node and through the bundle branches into the ventricle. Once it goes to the ventricles, you're getting the QRS complex. So this time, if it is increased, that indicates a conduction block. Okay? And sometimes you can also have things like this. So you will get a P wave, another P wave, and then you get a QRS, a T wave, P wave, P wave. So every second P wave is going to cross So this is also a block. That means one of the impulses is getting blocked. It is not passing on into the ventricles, but the next one is. So these are different types of heart blocks, conduction blocks that you can figure out. Okay?
So that's
Not going through the AV node. So that means there's a block. Okay? So every second impulse is traveling. So you have 1:2 block, 1:3 block. So different types of blocks are seen. Okay? There are lots of conditions that can do that. And then you also have where you see that the rhythm is abnormal. Rhythm is this. That means it should follow the same sequence, P, Q, R, S, T, P, Q, R, S, T. But occasionally you will find that the heart is beating at an erratic rhythm. So you might get something like this. Okay? Now this, anything where the rhythm is not proper, you call it arrhythmia. Okay? Arrhythmia simply means the absence of the normal rhythm. That is, I mean, you know, if you play a musical instrument or if you're into singing, you know if somebody is singing off key or playing an instrument off key. If it is not in rhythm, it sounds it's not music. Music is when everything is in a rhythmic fashion, you enjoy that rhythm. So the same thing with the heart, it has to, because of the conduction system, you need to have that normal rhythm where you have the P wave and then you have the QRS and then you have the T wave. And this should keep repeating itself. So when that doesn't happen, you're going to see some abnormal wave-like pattern like this. Okay, this is just one example, arrhythmia. Okay, and this particular type where you're not seeing any waves at all, but just seeing this is called ventricular fibrillation. Fibrillation means quivering or shivering. So the ventricle is not beating, it is just shivering. Okay, so there is no proper pumping happening. So this is a very serious condition. Ventricular fibrillation is a very serious condition because the heart is not pumping blood. It is just kind of shaking, that's all. It's not contracting and relaxing. So this is a serious condition. If left, if you don't do anything about it, it can end up being fatal. So in order to tackle this, you will see in most places, even in our campus, on the corridor, you would have seen a box, okay, a red box, and on which it says A, E, D, okay. What do you know what it stands for? We were talking about it this morning.
Automatic external defibrillator?
Yes, automated external defibrillator. Okay, automated. So the A stands for automated external defibrillator. So ventricular fibrillation. So it's a defibrillator. So it's going to make the heart stop that arrhythmia, and it's going to make the heart beat in a rhythmic fashion. So basically this is an automated external defibrillator is like when you punish your child who's throwing a tantrum. You punish the child and you say, okay, no more TV, no more watching your cartoons, go time out, go sit there for half an hour. Nothing, no toys, nothing. So it's a way of disciplining your child, okay, you have that. So the same thing happens here. The heart is not behaving itself, okay, for whatever reason, due to some disease, the ventricle is just quivering, not doing its job. So what does this external defibrillator do? It produces a massive high voltage current. The defibrillator has two pads, so it produces a high voltage current that shocks the heart. it shocks the heart into stopping completely. So this ventricle, which has been shivering, a huge current is passed and the heart completely stops. Okay, because it's jolted by that current, so it stops. The thinking is that when the heart restarts, when it starts beating, it will then follow the proper rhythm. It will come back to its senses. So the same way like you punish your child, you think that, okay, next time the child is not going to do the same mistake because it will remember the punishment. Exactly the same principle. So this external defibrillator passes a huge high voltage current to the heart, which makes the heart stop completely. And then when the conduction system resumes, when the SA node and everything starts again, you expect it to start beating properly. Okay, so you can do it a few times, but after that, if the heart still does not revive, that means that's the end of life for that person. It's about, so arrhythmia is that, okay? So basically, irregularity in the heart rhythm can arise due to many conditions. Arrhythmia can even happen due to ionic disturbances, okay? So, and then there are many categories for that: tachycardia, bradycardia, fibrillation, okay? So sometimes the arrhythmia begins in the atria. So you call it supraventricular arrhythmia because it's on top. And sometimes it's the ventricles, so you call it ventricular arrhythmia, okay? So without going too much into the details, this is just to introduce you, okay? So don't get too confused with all of this. So remember normal ECG. Now we go on to the next part, which is, so you have seen the electrical activity of the heart. We've done the electrical activity. Now we are going to look at the actual contraction and relaxation of the heart, okay? The mechanical contraction and relaxation. So the title for this series is Cardiac Cycle, okay? Now cardiac cycle, what exactly is a cardiac cycle? So if you were to define it, open it. If you were to define cardiac cycle, cardiac cycle is the sequence of events that occurs during a single heartbeat. So whenever we say my heart beats 70 times per minute or 75 times per minute, beats per minute, what exactly is happening during each of those beats inside the heart? That is what is called the cardiac cycle, okay? The sequence of events that occurs during a single heartbeat. So obviously, you know, the heart is going to contract and relax, okay? And the main pumps, we are dealing with the ventricle mainly because the ventricle is the one that's going to fill up with blood and it's going to pump the blood out, okay? So with every cardiac cycle, you're going to have systole. Systole means contraction, and diastole, which refers to relaxation. Okay? During relaxation, during diastole, ventricles fill up with blood. During systole, ventricles pump the blood out. Okay, this is the gist, this is the summary. So before the ventricles can pump the blood out, obviously they have to fill up with blood. So during diastole, when they are relaxed, when the cardiac muscle is relaxed, ventricles fill up with blood. Systole, they pump the blood out. Okay. Now, each heartbeat, let's say your resting heart rate is around 75 beats per minute. Okay. If the resting heart rate is 75 beats per minute, each beat will be roughly 0.8 seconds. This is each heartbeat, okay, when you are resting. Of course, when you exercise, it is going to go up, okay, heart rate will go up. So each heartbeat is roughly 0.8 seconds. Out of this 0.8 seconds, so one cardiac cycle is 0.8 seconds, one heartbeat. Out of this 0.8 seconds, the heart spends more time in diastole. So 0.5 seconds is diastole, the remaining 0.3 seconds is systole. Okay, so the heart spends more time during the relaxed phase to fill up with blood. And then it contracts and pumps the blood out. Okay, so during each cardiac cycle, we have to look at blood flow. Blood flow in the heart chambers. Where exactly is the blood flowing? So during each heartbeat, we have to look at some of these. And we are going to see the phase, or see what happens. And then, of course, remember, this is a liquid. Blood is a liquid which is flowing through the heart and getting pumped out of the heart. So any liquid will produce a pressure. Okay? So we have to look at the pressure changes that occur during one heartbeat. Third thing that we are going to look at, because there are 4 chambers and there are 4 valves, we have to look at which of the valves open or which of them close during the cardiac cycle. Okay, so we have to look at the opening and closing of the valves. Okay, so cardiac cycle includes all this. So a single heartbeat includes all of these things that we are going to look at. Now, pressure changes. I'm not sure how many of you are familiar with basic physics, but if you have a tube and you have 2 ends of the tube, you want the liquid to flow from A to B in this direction. What should be the pressure like at the 2 ends? How will liquid flow from A to B? You only want it to flow like this. What should be in A? High pressure. So there should be high pressure here. So either you should have a faucet or something that's going to push the water out. So there should be high pressure. And then what about this? Low pressure. Okay, so this is the basic fluid dynamics. Okay, liquid always flows from a region of high pressure to a region of low pressure. Okay, so please remember that. So once you remember that, then you will be able to understand in which direction blood is going to flow. Okay, so high pressure. In the case of the heart, how do we generate high pressure? We generate high pressure by contraction of the muscle. Contraction of cardiac muscle will generate a high pressure. If the muscle relaxes, the pressure will be low. Okay, and also high pressure can be also due to the amount of blood that is filling up. It can also be the amount of blood that is in the chambers. Okay, so just remember this part and then we will see what happens in the cardiac cycle. Now, in very simple terms, it's easy. Ventricles fill up with blood. From the atria, you know, right atrium passes the blood to the right ventricle, left atrium passes it to the left ventricle, and then the ventricles pump it out. Okay? So it's as simple as that. But then, during the cardiac cycle, during each heartbeat, you can actually divide what happens into 4 separate phases. 4 phases. Okay? Now that is where a little bit of understanding needs to happen. So phase 1 of the cardiac cycle. So cardiac cycle, 4 phases. And in each phase, we are going to see how is the blood going to flow, which valves are open, which valves are closed, where is the pressure high, where is the pressure low. Okay? So let's start with the first phase, phase 1. Now, because it is a cycle, you can start anywhere. It goes round and round. Okay, so you start here and then you end here. Phase 1, phase 2, phase 3, phase 4. You can start here and then you can end here. So it doesn't matter. Okay, but we will start with whatever is there in your book. Phase 1 is called the ventricular filling phase. Ventricular filling phase. So some of you might have already read about it a little bit, so it should make it easier for you. But for those of you who have not read it earlier, please pay attention. Okay, ventricular filling phase. Let's start with this. So as the name indicates, the ventricles are filling up with blood. Okay, so when they are filling up with blood, you know that they have to be relaxed. Okay, so during the ventricular filling phase, what about the 2 atria? Atria are also relaxed. Okay, so there is no contraction of the atrial muscle. Atria are also relaxed. Ventricles are also relaxed. Atria are filling up with blood. Now, when I say atria are filling up with blood, remember right atrium gets blood from the inferior vena cava and the superior vena cava. Left atrium gets the blood from the pulmonary veins. So the atria are filling up with blood, and because they are receiving blood, pressure in the atria is slightly higher than pressure in the ventricles. So the atrial pressure is slightly higher because blood is constantly filling up in the chamber. Okay? So the atria are filling up with blood. So because they are filling up with blood, the pressure is a little bit higher, not too much, little higher, but all chambers are relaxed. Atria is relaxed, ventricles is relaxed. Simply because atrial pressure is a little higher than ventricular pressure, this increased pressure will force the AV valves open. So during the ventricular filling phase, AV valves are open. AV valves are open. Semilunar valves are closed. So if you remember when we were talking about the valves, I told you AV valves will open downwards into the ventricle. Whenever pressure in the atria is higher, it will force the valve to open. Semilunar valve will only open when the pressure in the ventricle is high and it forces that valve to open. Okay? So here, pressure in the ventricles is low because all of them are relaxing. So the ventricles are relaxing, atria are relaxing, but because the pressure in the atria is slightly higher, the AV valves are open. Okay? And now you know, liquid flows from a region of high pressure to a region of low pressure. So in this case, the pressure in the atria is slightly higher. So blood flows from atria into ventricles. Okay? But here you can see that there is no contraction of the muscle. The cardiac muscle is not contracting. Blood is flowing from atria to ventricle because the atria, the pressure of, it's filled with blood, so the pressure is slightly higher. So we call this passive filling of blood. There's no active muscle contraction. So this is passive filling of the ventricles. It's passive filling. So almost 80 to 90% blood from atria fills up in the ventricle during this first phase, ventricular filling phase. Okay, so let me reiterate that. First phase, we start with the ventricular filling phase. The entire heart is relaxed, no muscle contraction. Okay, atria are filling with blood. Ventricles are relaxed. The pressure in the atria, because it is filled with blood, the pressure in the atria is slightly higher than the pressure in the ventricle. So the AV valves are open and blood flows passively from the atria into the ventricles. This is passive filling. Okay. Now we move to the next stage. Okay. So towards the end of this phase, passive filling phase, okay, towards the end of this, so 80 to 90% of the blood from the atria has gone into the ventricles. So there is still some 10% blood left. So that 10% of blood comes into the ventricle, active contraction of the atria. So at this point, you're going to have atrial systole towards the end of phase 1. So towards the end of phase 1, atrial systole occurs. Okay, so when will actual contraction occur? The SA node would have fired, the impulse would have traveled through both the atria, and then after the P wave, the muscle will actually contract because the electrical signal has come. So now it is going to contract and it will push the remaining 10% into the ventricles. Okay. So atrial systole occurs, this occurs towards the end of phase 1, pushing the remaining 10% of blood from atria into ventricles. Okay, so this is the end of phase 1. This is the end of phase 1. Ventricular filling phase followed by atrial systole is phase 1. So the ventricles are now filled with blood. Okay, the ventricles are now filled with blood. So they are relaxed, they are filled with blood. How much of blood is there in each ventricle? We have to look at that. Only then we will know how much it is going to pump out. So the amount of blood at the end of phase 1, amount of blood in each ventricle. Okay, note the fact, each ventricle, I'm not totaling the two together. Amount of blood in each ventricle is about 120 to 140 ml. 120 to 140 ml. So if you have your little bottle of water, that is 500 ml. That bottle of water that you buy, that small bottle, that is 500 ml. So you divide it into 5 parts. That's roughly the amount of blood that you'll have, or if you divide it like 1/3, that's roughly the amount of blood that is there in each ventricle. Okay? We call this, there's a name for this. Okay, this blood that fills up in the ventricles are in the relaxed state. This is the end of diastole of the ventricles. They have finished filling up. So this is called end diastolic volume, or EDV. End diastolic volume, or EDV. Because this is the end of diastole of the ventricles. So the 0.5 seconds when it fills up, that's what this is. Okay, phase 1. So I hope you are getting this. This is, it's not that difficult, because, I mean, if you are simply going to explain it, yes, ventricles fill up with blood and then they pump the blood out. But there are lots of things that are happening during this period. And why do the ventricles fill up with blood? What is happening? That is what, these are the details of that. Okay? So phase 1 is ventricular filling phase, which ends with atrial systole. So atrial systole, out of that 0.5 seconds that we said, ventricles are in the relaxed state, this is almost 0.4 seconds. Okay? This is only 0.1 second. So atrial systole is very quick, only in the last stages, because you want to push some of the remaining blood into the ventricles. That's it. Okay? So remember this, how much of blood is there in each ventricle. Okay? Now, phase 2. Phase 2, the second one. Now that the ventricles have filled up with blood, the next step is they have to start contracting to pump the blood out. So the second phase is called isovolumic ventricular contraction phase. Isovolumic ventricular contraction. This is the second phase.
Is it isovolumic or isovolumic?
Volumetric, both are the same.
Okay.
Both are the same. Volumetric or volumic, both are the same. You can either use either or. Okay? Volumetric or volumic, both are the same. So some books will say isovolumic, some books will say isovolumetric. So, okay? So we can use isovolumetric since that is what is there here. So you can use isovolumetric ventricular contraction. Okay? It means the same. Now, as you can see, isovolumetric, that means iso means same volume. So during this stage, what is happening? Ventricles are filled with blood. Okay? Ventricles begin to contract. So it begins now. So the QRS complex has happened and the muscle is starting to squeeze the blood. Ventricles, this is important, ventricles begin to contract. They have not completely contracted, it's only starting. Pressure in the ventricle increases slightly. So it doesn't go up too much. So they've just started contracting. So as the muscle squeezes the blood that is inside, the pressure in the ventricle starts to slowly go up. Okay? Now when the pressure in the ventricle goes up, it will push this AV valve upwards and close it. Okay? So this will lead to closure of the AV valves. Okay? Because as the ventricles contract, they're going to push the AV valves. Now, when the AV valves close, you are going to get the first heart sound. So this is when the first heart sound S1 is produced due to closure of the AV valves. Okay. So now the pressure in the ventricle is higher than the pressure in the atria. Okay, that's why it will push the valve close. But the pressure in the ventricles is not high enough. It's not high enough to force the semilunar valves to open. So the semilunar valves are still closed. Okay, so AV valves are closed, semilunar valves are closed because the ventricle has just started contracting. So the pressure in the ventricle is not sufficient to force the semilunar valves to open. They are still closed. Okay, so when AV valves are closed, semilunar valves are closed, will blood flow anywhere? No. So during isovolumic contraction phase, no blood flow. That's why it's called isovolumic, same volume. There's no change in the volume of the blood that is in the ventricles. No blood flow because both valves are closed. Okay. Now here I would like to again remind you, the AV valves close and they remain closely shut because of the papillary muscles and the chordae tendineae, okay, which help them to keep the valve closed. Otherwise, if the chordae tendineae are broken or the papillary muscle doesn't work, this valve won't close. So when the ventricle starts contracting, there'll be backflow of blood into the atria. So the chordae tendineae and the papillary muscle prevent that. Okay, so that is phase 2. Phase 2 is what is happening during phase 2? Pressure in the ventricle is rising. That's what is happening. Okay, before it can pump the blood out. Now, coming to phase 3, the next one. Phase 3 is known as ejection phase. Okay, or you can say ventricular ejection phase. Ventricular ejection phase. So what is happening at this time when the ventricles are contracting? Okay. Atria are relaxed. When the ventricles are contracting, atria are relaxed and slowly filling up with blood. Slowly filling up with blood. Ventricles continue to contract. So they started contracting over there, they continue to contract strongly, strong contractions. And when they contract strongly, pressure in the ventricle rises. It goes up because the muscle is now squeezing the blood. Okay, pressure in the ventricle increases, and this forces the semilunar valves to open. So pressure in the ventricles forces the semilunar valves to open. Okay, so that's because from below the pressure is increasing. So this forces the valves to open. And once the valves open, AV valves are still closed. Remember that. Semilunar valves are open, AV valves are closed. AV valves are closed as pressure in atria is less than pressure in ventricles. So the key point to remember is AV valves will open when pressure in the atria is high. Semilunar valves will open when pressure in the ventricle is high. So in here the ventricle is contracting, so the AV valves will be closed. Okay? Semilunar valves open. And now that the semilunar valves open, blood flows from ventricles into the pulmonary trunk and aorta, respectively. From the right ventricle, it will get into the pulmonary trunk. From the left, it will get into the aorta. So blood flow occurs from the ventricles into the pulmonary trunk and aorta. Okay? So now the question arises, how much blood gets pumped out? How much blood gets pumped out? So we know how much blood was there at the start. We know there was 120 to 140. Not all blood goes out. Blood never empties completely from the ventricles. There is always some blood left in the ventricles. Even when you're exercising and your heart is pumping maximally, there is always some blood left. So out of this 120 to 140 ml, each ventricle ejects 70 to 90 ml of blood out. 70 to 90. 70 under resting conditions, 90 under very severe exercise conditions. So it never empties itself. This is important. So each ventricle ejects. Right ventricle will pump out 70 ml when you're resting. Left ventricle will pump out 70 ml. This is called stroke volume. These are very important parameters in cardiovascular physiology. Stroke volume, it's called the stroke volume. How do you define stroke volume? The amount of blood pumped or ejected by each ventricle during the ventricular ejection phase is called the stroke volume. Okay? So get the definition right. Stroke volume is the amount of blood pumped by each ventricle, okay, during the ventricular ejection phase. Okay? So 70 to 90 is called the stroke volume. So obviously some is left behind, right? So what is left behind, the 40 to 50 ml, is called end systolic volume. That is after the systole, after the contraction, whatever blood is remaining, okay, about 40 to 50 ml. This is the blood remaining in the ventricles. This is called end systolic volume. Now all of these can be measured using the echocardiogram. So when you do, especially when you have a patient who has some heart issues, you can measure all this. You can actually see the heart pumping the blood, you can see the semilunar valve opening, you can see the AV valves closing. All of this is possible. Okay? Yes, did you have a, yes. Now we come to the last phase, phase 4. Phase 4 is known as the isometric ventricular relaxation phase. So now the ventricles have to relax. Relaxation phase. After they have pumped the blood out, they have to relax. Okay, because now the next pumping can only happen after they fill up with blood. So in the isometric or isovolumetric ventricular relaxation phase, the ventricles begin to relax. So the muscle starts to relax. Ventricles begin to relax. Pressure in the ventricles starts to decrease. So it doesn't decrease all the way down immediately. It just begins to decrease. As the ventricle slowly relaxes, pressure in the ventricle starts to decrease. Okay? And this is going to cause closure of the semilunar valves, because now the blood vessels, you have pumped the blood into the blood vessels. So the pressure here is higher. Okay? The ventricles are starting to relax. So the semilunar valves will snap shut at the beginning of the relaxation of the ventricles, or just as the ejection finishes, ventricles start to relax, semilunar valves will close. This produces the second heart sound, S2, closure of the semilunar valves. But the pressure in the ventricle is not low enough for the AV valves to open. It is still quite high. The ventricles have just started to relax, but the pressure is still high. It is not enough to open these valves. Okay? So they have to relax further before the AV valve can open. So AV valves are also still closed. Semilunar valves are closed. AV valves are also closed because the pressure in the ventricle is still high. It's not low enough. It should become lower than the pressure in the atria. Only then this valve will open. So it is still high. So that is closed. So because the semilunar valves are closed, AV valves are closed, there is no blood flow. So you call it isovolumetric relaxation phase. And the ventricles will continue to relax, and then it will go back to phase 1, which is the ventricular filling phase. So the ventricular pressure will decrease, atrial pressure will be higher than the ventricle, it will force the AV valve open, ventricles will passively start filling up with blood. So that 70 to 90 ml, which was pumped out, will refill. It will refill again, and then the whole process starts again. Okay? So that is, all of this happens within a second. Okay? Within 1 second or so, 0.8 seconds. It is done. Okay? The whole thing is done. But this is a sequence of events that occurs during the cardiac cycle. So you can, like I said, under the study area you have animations. If explanation is not very clear for you, you can watch it as well. It goes through all these phases. Okay? What happens in the first phase, second. So the important thing here is the definitions. You should know what is stroke volume. You should know what is end diastolic volume, end systolic volume, and also closure of the valves and how blood flows. Okay? Yes.